Good evening, everyone. Welcome to our bi-monthly webinar, Bridging the Information Gap. I'm your host, Ward Blackwell, the Executive Director of the Pennsylvania Dental Association, and we are really happy to have so many people joining us. This is the second one of these webinars. We've opened up to all PDA members, and it's great to have everybody listening in. First thing tonight, we got to go through some basic instructions, especially because we know we'll have some first-timers joining us. Basically, as the nice recorded voice said, all of our attendees are in listen-only mode. You cannot open your mic and interject during the presentation. However, you can use the question box to type in a question for any one of our panelists. We always reserve the last 10 to 15 minutes of the hour for questions and answers, and you can type them in at any point throughout. In fact, I encourage you to do it early, and that makes sure you will be at the head of the line and more likely to get your question answered at the end. I will read them aloud and direct them to the appropriate panelists. Just if you're wondering where that is, it should be on the right side of your screen, and that control box is where you find the question box. Okay. As always, we need to recognize our sponsor, the Pennsylvania Enterprise Resource Corporation, which runs the PDA Member Advantage program. Lots of tremendous deals, great values that only PDA members can get. Strongly encourage you to look at that, whether it be the dentist supply company and tremendous discounts on supplies, to our one platinum sponsor, Best Card, which is saving dentists roughly $6,000 on average on their credit card processing costs per year. Tremendous opportunity for you to save money. Please check it out. Now, with those preliminaries out of the way, I'd like to introduce our panel for tonight. Joining us this evening are Dr. Linda Himmelberger, Chair of our Governmental Relations Committee. I'll be doing a short presentation myself. Dr. Lauren Yap, who is our representative to the ADPAC board. Dr. Seth Walbridge, Governmental Relations at the ADA level, our representative there. Dr. Jim Talberg, our ADA trustee. Dr. Ted Rockwell, our PDA president, and Dr. Ron Heier, the chair of the PDA Annual Meeting Steering Committee. That is tonight's panel. And without any further ado, we're going to get started because we do have a lot with so many people to go through. You'll sense a long theme here of governmental relations because there's so much going on there. And who better to kick that off? Dr. Himmelberger.
Thank you, Ward. We have the next slide, Michelle. Great, thank you. So as you all know, we've just begun the second year of the two-year legislative cycle in Pennsylvania. Both the chambers have returned to session this week, and Governor Shapiro is set to give his budget address tomorrow. The PDA will continue to monitor budgetary issues, particularly Medicaid, and the Rural Health Transformation Plan, which is something new. I'm going to be talking about that a little bit later in my segment, and I believe Ward is also going to talk about that in his segment. So stay tuned for more information. You'll be hearing a lot about this in the upcoming months. If we have the next slide, please. One of the particular pain points for our members, and one of the things that's generated a lot of discussion is dental loss ratio. So currently we have House Bill 1325 that's been introduced by Representative Kyle Mullins. We're currently working on refining the language with the Health Insurance Committee staff, specifically related to the size of employer-offered dental plans that would have to report their dental loss ratios to the Pennsylvania Insurance Department. And we're taking it as a very positive sign that the committee staff has reached out to the stakeholder community, to PDA, to solicit feedback. And we are going to be pushing to have a vote on this legislation very soon. Currently, we are in the process of identifying a senator, a state senator, who would be willing to sponsor a companion bill in the Senate. So stay tuned for updates on that particular effort as well. Next. Thank you. We recently submitted comments to the House Communications and Technology Committee regarding proposed legislation regulating the use of artificial intelligence, AI, in healthcare. And while the bill is much more germane to hospitals and large health systems, we thought it was important that we go on record with our comments early, and a request that the committee engage PDA on these AI-related legislative matters so that we can move in early to address any requirements that might impact dentistry. Some of the things that we're addressing is the clarification of ambiguous definitions around health insurance policy, healthcare provider, healthcare facility. Sometimes it's hard to tell whether dentistry is included in those definitions or not. And we want to make sure that the legislation is very clear as to whether we're in or we're out. Because obviously going forward, it would make regulation much easier if we know exactly what groups we're dealing with. And while we recognize that it's important to let patients know how artificial intelligence might be impacting their treatment, there are proposed reporting requirements to the Department of Health, annual reporting that we think may be burdensome for small group practices or solo practitioners. So we are going to suggest that dentists in those practice modalities be excluded from those kinds of reporting requirements. And again, as with medicine, AI has a role to play, such as with imaging and diagnosis and treatment planning, but it's no substitute for human expertise and clinical judgment. In other words, if you're submitting a treatment plan, I think we'd all rather have a colleague review that than R2D2. And again, while PDA sees the value in insurers using AI for administrative tasks, again, when it comes to expediting claims processing, we believe that it should be humans with the appropriate clinical expertise and specialty knowledge that evaluates and makes determinations. So we could go on to the next slide. Thank you. The PDA lobbyist, staff, and PR consultant also met recently with Senator David Argall, who is his chief of staff, to discuss dental workforce issues. The senator has risen to the forefront in support of initiatives to improve access to dental care, specifically or especially in rural areas. He's the primary sponsor of our credentialing reform bill, and he is the driving force behind an initiative within Temple University School of Dentistry that would bring to fruition the program that would allow Temple dental students to complete part of their education and training in rural communities, right now starting in Tamaqua. So he has been one of our allies in our efforts. I wanted to also, as you see there, note that we've discussed plans with him to launch PDA's public relations campaign aimed at educating policymakers in the media about how Pennsylvania ranks first in the number of dentists who leave to practice elsewhere. I'm not going to go into this in too much depth now. Ward is going to be covering this issue in more depth, but you know, I'm a proud Pennsylvania born and raised, and this is not a first that I wanted to be part of. I don't think any of us wanted to be number one in the place where people are leaving. So we could go on to the next slide. So I promised you some more information on the Rural Health Transformation Plan. Recently, the Center for Medicare and Medicaid Services, CMS, which of course is a federal agency, announced that all 50 states will receive awards under the Rural Health Transformation Program, a $50 billion initiative established under President Trump's Working Families Tax Cut legislation. These $50 billion in funds will be doled out in $10 billion increments over the next 5 years. And in this initial year, $193 million has been granted to Pennsylvania. The purpose of these monies is to address oral health care disparities, particularly rural oral health care disparities. The PDA had quite a bit of input as Pennsylvania was putting forth its proposals for grant money. 2 of the initiatives that we had recommended was to help with funding for the University of Pittsburgh's initiative to create regional dental training centers. And there's also a recommendation that scholarship programs be developed so that it would incentivize dentists and dental team members to practice in rural areas in Pennsylvania. I'm also happy to report that PDA was asked to serve on the Governor's Advisory Council, tasked with offering recommendations and guidance to this rural health transformation plan. I think it's a feather in our cap that we are part of this planning and execution for these very important dollars that are coming into the Commonwealth. So with that, I'll turn it over to Ward to elaborate on our public relations campaign and call to action as we work towards improving the dental workforce and access in Pennsylvania.
Thank you very much, Dr. And just kind of dovetailing off what she was talking about, this campaign and the crisis report, which you probably have seen by now as it's been released to all our members, is essentially falling into that same set of issues of workforce. The same time as we were talking to the administration and trying to get more and more focus on dental workforce issues in the rural health transformation plan, we were also recognizing and planning how we can take those issues and tie them to dental insurance benefits, because the state of dental insurance is making it harder to practice here, which is driving dentists away. The workforce issue leads to access issues, which do concern policymakers. So we can kind of reverse the thinking there, get them concerned about the access and workforce, then it makes them much more amenable to our ideas about dental insurance reform. So this report was produced. Hopefully you've all seen it. If you haven't, you'll be seeing more of it, and you can get a glimpse of it from multiple sources from PDA. But as it was getting to the final stages, an opportunity to sponsor last month's healthcare summit being presented by City and State Magazine in Harrisburg was kind of dropped in our laps. This seemed like a great opportunity to begin getting wider distribution of that crisis report. Amongst the benefits we got, we're being able to get email addresses for all the attendees and, of course, present briefly to the attendees. And I kind of summarize what we shared with the attendees. A few of the things that we shared in terms of facts, for instance, we shared that between 2014 and 24, Pennsylvania experienced a 13% decline in the number of dentists per 100,000 residents. That's the statistic Dr. Himmelberger referenced. Now that's higher than every other state and DC. Number one in the country, bad thing to be number one in. But it's not purely a supply issue. Nationally, the number of dentists is growing. It's fueled by more graduates from dental schools, including from Pennsylvania dental schools, but they're not choosing to practice here. So while the dental workforce gets younger everywhere else, in our state, 45% of the dentists are now over age 55. Now, as you'd expect, rural communities have been hit hardest. In some counties, residents wait up to 2 years for an appointment, and the closest dentist for some patients may be more than 100 miles away. All these issues have significant public health and economic impacts, and that really tied in well to the theme of the summit. Speaker after speaker there lamented the adverse consequences of a healthcare system that is in deplorable condition. Yet the barriers to starting and sustaining a dental practice in Pennsylvania, they still stand out as critical issues beyond everything else. And that really discourages new providers from serving where they're needed most. So the goal of our campaign over the next few months will be to convince Pennsylvania's leaders to take action to create a more competitive practice climate to attract and retain practitioners, especially in rural areas, and to get them to be more open to common sense reforms, especially to dental insurance. Those sort of things that will expand access, they'll improve care, and they'll promote equity in the underserved communities. So we drove that message home. Hopefully you'll be hearing a lot more about it in the coming months. With that, it's time to segue to our next presenter. Keeping on the government relations theme, we'll hear from our AdPAC representative, Dr. Lauren Yap.
Hi, everyone. So it's almost my favorite time of the year, which is Advocacy Month. So this year's ADA Lobby Day will take place March 22nd to March 24th. And I actually want to cover a couple of really exciting changes to this year's Lobby Day. So we know that we have a wonderful Washington, D.C. ADA team. They have such a strong reputation on the Hill. I believe that, we are in the top 10 of the PACs when it comes to healthcare. However, it is such a crucial year for us this year, and we want to make sure that not only are we using our efforts wisely, but we're also putting our time and our energy. And so we are actually going to see that Lobby Day is going to go more towards grassroots lobbying. The numbers of members that have been coming have gotten so large, and we've had such great student participation. But it's also a double-edged sword because a lot of these congressional offices cannot house and cannot have really fruitful meetings when there are so many people there. So in such a very important year, one of the changes that Lobby Day is going to focus on is to really connect local dentists within members of Congress. Those meetings are going to allow for us to provide education, for the dentists to really have their voice be heard by those that are making these decisions that impact the way we practice, that impact our patients, and we'll be able to provide that perspective in a much more fruitful and effective manner. So that we can also build relationships. We know that so much of what happens in Washington, D.C. isn't just based off of the 2 days that we are there. The relationships that we're able to form with members of Congress, with their staff, so that if there is something that comes up, they know, hey, I need to call my dentist. I need to call the dentist in my area. I need to call the dentist that showed up and was able to discuss, brought me all this information. So we really want to really facilitate those relationships that are going to extend beyond ADA Lobby Day. So with that being said, actually, the formal funding for students will actually be focused on the ASDA board members. One of the things that I brought up during the meeting is I was a student that really benefited from this event. I have attended almost 11 lobby days, and I didn't want that students in our state who do have a passion for it and who possibly want to pursue it in their future to miss out on this opportunity. So per the approval of the State Dental Association, if you know of a student, if you know of somebody that has attended your local events that is very passionate and wants to participate in this, we can have selective student participation for ADA Lobby Day, and we can work with the State Dental Association, the PDA, regarding that. But as I mentioned before, it's a very crucial year in DC. There's a lot of topics in dentistry that are being looked at, and some might even say are being fired at. So we really want to make these visits as fruitful and as beneficial as possible. Once again, we have so many members that attend this, and it has been such a successful event. We will still be staying at the Marriott Marquis in Washington, D.C. Next slide, please. What's going to happen, though, to all of the students that aren't able to attend ADA Lobby Day? So there will actually be a local lobby day initiative that dental students will be able to implement at their respective dental schools. Working with the PDA, with faculty, as well as with leaders from the ADA, they will be able to have kind of like a toolkit that will help them plan their own kind of local lobby day initiative at their school. So they can invite members of Congress or their staff to tour the campus, as well as to almost do like a lunch and learn, right? So talk about issues and discussions that are tied to national advocacy priorities. And once again, the ADA will help with training, planning tools, and resources. As an educator, I'm really excited to see how this is going to come to fruition. And I'm excited to see our dental students we're very lucky with the dental student engagement that we have in Pennsylvania, both currently as well as in past history. So I'm excited to see what we can do and how we can help our students make this a very successful local initiative. Next slide, please. So, I mentioned before that it's never my strong suit in asking for participation and monetary participation for AdPac, but if I myself wouldn't do it, I wouldn't ask for you to do it either. And I am asking you because I believe in it and I have participated in it. I think so strongly of what our PAC can really do. We stand in Pennsylvania as District 3. We are number 3 in terms of year after year growth. So that's wonderful. But we need to capitalize on that growth. And we need to not wait until ADA House of Delegates, especially in such a crucial year. So you've heard it said before, AdPac is not, one party over the other. It's the tooth party. It's bipartisan. It's based off of who is supporting the issues that matter to dentists, to our dental priorities, our ADA legislative priorities, as well as for our patients. And so if we wait until October when we have the House of Delegates, we're almost a little too late. So you should be receiving an email from me. If you have any questions at all in terms of how to donate to AdPac, please don't hesitate to reach out to me via email or call me. I'm happy to walk you through that. I'm even happier to tell you about some of our wins, especially in such a tumultuous political climate. We have had these wins. So at the end of the AdPac board meeting, where did we fall in terms of all of the districts? We were number 6. I know we can be top 3 and maybe even top number 1 because I know that our state has a lot of pride for what we do. And like I said, I'm happy to help anybody. If you have any questions at all in terms of, what this money is going towards and how we plan on using it, I'm happy to converse and let you know all of our priorities. But I know that if we are number 3 in terms of growth, we can definitely at least be number 3 in the total status of where we fall for donations. So thank you, everyone.
Thank you very much, Lauren. And I got to say, in an election year, we can really have a big impact. Great time to be making this, plea for extra contributions. As keeping with our governmental affairs theme so far, I'd like our ADA representative on the CGA to tell us what all these PAC donations might lead to in terms of legislation and what else is going on with the council. Dr. Walbridge.
All right, thanks, Ward. Good to see everybody. I wanted to touch on ERISA at the end, but before that, I just wanted to touch on a couple of things that CGA is doing. And I've only really had 2 Zoom meetings, so we haven't covered a whole lot, but there's always stuff to do on the side. So it's been pretty intense. But the first thing that came up was HIPAA issues with online reviews. So essentially what we discussed in a workforce subcommittee was if a patient kind of bashes your practice or bashes your character, there's no real recourse for you, or you have to pay a company to try and remove the review. It's a real pain. So far, there isn't really a whole lot you can do because of the legal issues with doing that. You can't say a patient's name. You can't, address their treatment. There's a lot of roadblocks. So this topic has come up many times. So CGA is actually taking a look at it to see if there's anything we can do or provide some kind of ADA member benefit to kind of battle this, because it's really unfair. A legislative roadshow is potentially happening in 2026. So a big problem with the ADA is we don't really communicate our successes. So Jim Schultz brought up the kind of the legislative roadshow to kind of help promote, you know, the ADA, what we're doing for our members, what we're doing on a legislative basis, because legislation is really where the rubber meets the road. So that's been brought up. We haven't really gotten into a lot of details with it because they're still trying to put it together, but they're probably going to come through Pennsylvania, and that would be awesome. The next thing that we discussed was a program called Immersify. So Immersify is kind of a training program that they give to high school students or people for on-the-job training. So Immersify could be used, for example, if you are having trouble hiring a dental assistant. You could possibly bring a dental assistant in even off the street, and they could sit down with Immersify, and there would be a whole program for them. There's also a patient service coordinator program that they're trying to bring out, which would essentially be like a front office team. And the ADA CE team is working on this currently. They are looking for pilot offices eventually, and then when that comes up, I'll be sure to let you know. But something down the pipe that we're trying to, you know, help our members out, especially with workforce issues. Everyone's short-staffed, or a lot of people are short-staffed. And then that's really it. Lauren touched on anything lobby day, so thanks, Lauren. That was the other thing I was going to discuss. But the other thing that I want to discuss, and this will come up at lobby day, is something called the Waiver Act. So the Waiver Act involves ERISA, and bear with me. So the Waiver Act stands for Waiving Applicable Interference for Viable ERISA Reform. So it's a critical piece of legislation that would help restore states' rights when it comes to ERISA. I see Jim laughing. Yeah, it's a mouthful. States are losing a lot when it comes to ERISA because ERISA basically takes everything out of the state's hands. And what is ERISA? That's the Employee Retirement Income Security Act. So it's a federal law that regulates employment benefit plans, including dental plans. So federal is the big key here. Self-funded plans are the majority of what we're seeing now. So when an employer pays an employee claims from its own funds, even if an administrator handles that claim, the plan is self-funded. And those plans are governed by ERISA, so it's easy to sidestep. The employer pays the claims directly. Less seen are the fully insured plans, and that's if employer buys a plan from an insurance company. The insurance company pays the claims, not the employer. It's fully insured. So those plans are regulated mostly by the states, but ERISA preempts or supersedes state insurance laws for self-funded plans. So what does that mean for us? State laws that could protect our patients and dentists, such as, you know, something like fee capping. It doesn't apply to these self-funded plans because they can sidestep it with ERISA. And since ERISA has been established, even more than half the plans that we see are self-funded, and makes insurance laws easy to sidestep for larger corporations and larger companies that can afford it. So that is something that I'm sure is going to come up on lobby day, and I have talked to Representative McKenzie in Pennsylvania. I've met with him and his staff, so we're battling, and you know, we'll see what happens with it. But any questions, let me know. I know it's a mouthful and very brief, but it's been pretty intense with ERISA. So that's what I have. Thank you.
Thank you very much, Dr. Walbridge. And yeah, I can't tell you how many times I felt awful being the bearer of bad news, having to tell a dentist with a problem with an insurance company that there's nothing that the state can do because it has a ERISA preemption. Anyway, that would be a tremendous victory if we can pass that, but we got a long way to go. And there's a whole lot of other things that ADA is up to fill us in on those. Our ADA trustee, Dr. Jim Thalberg.
Well, good evening, everybody, and welcome to a great evening of learning. So I'm going to talk to you about a couple things going on at the ADA. It's been a little bit of a quiet time since the House of Delegates back in October. We're going to really kick into gear in February, and certainly by March we'll be in full swing. But let me give you a couple of quick things. The first thing that I'm going to talk a little bit about is the ADA budget. So in regards to the budget, we have made really great progress on the ADA's financial health. In 2025, the ADA leadership is focused on strengthening the association's financial foundation so we have a much more sustainable future, and the outlook is really bright for 2026. In November, the ADA Board of Trustees approved a 2026 budget that maintains that positive momentum, and that's thanks to a very disciplined stewardship and operational efficiencies. So what basically occurred was initially the budget that was set prior in 2025 had us actually at about a $12 million deficit. We were spending money we simply didn't have. But by 2026, what we've been able to do is to bring that down to about a $4 million deficit. So we've actually done a major improvement over the recent years, again, from well over 12 million. In fact, some reports had it as much as 20 million down to a $4 million deficit. I will tell you that next year's budget advances our trajectory towards what will be a much more full financial stability, with the shortfall requiring only minimal draw from reserves to cover the scope of planned 2026 initiatives. And our commitment is to success of our mission and to deliver to all of you practice support, educational resources, scientific discovery, and the advocacy that really helps us thrive. So that's my comments on the budget. The next one I want to talk to you about is the association management system. As many of you know, the management system was doled out at some time last year due to a just massive amount of customization. It was all over the place, and that required a lot of spending to try to bring it under control, and a great deal of error that had to be brought back under control. Basically, what we have is we have an AMS system, which is a software that handles member data, renewals, and events. We then have what's called a customer relationship management system, or CRM system. That's a broader tool for managing the interactions between the members. So for all of you who wonder what is Fontiva Salesforce, Fontiva is our association management system, and the CRM is actually the Salesforce. So they work together in tandem. One brings membership data, one helps to understand what your membership data means, and ultimately provides our members with a more personalized service. Specifically in Pennsylvania, we found out that we are not on Salesforce Fontiva at the current time. We are still on our current management system, which meant that our system was very accurate. We've been on it for a number of years. As a result, as we take our data and bring it into ADA data, we found that the data didn't always match. So at this point, there's been a great deal of discussion. I give heavy thanks to Mary Donlin and her team and working with the ADA to make sure that our data is done properly. At the current time, the data has gone from about 175 members that were not always noted to be correct within the ADA system, down to about half that number, and is continuing to be spelled to be more correct. In the meantime, the reconciliation with us is going to continue. At this point, all the affected dentists who were not listed necessarily as members are all going to be appropriately flagged in the ADA systems and ensured uninterrupted access to member benefits. Certainly all our end of the year reports through the ADA will include disclaimers reflecting the outstanding non-system reconciliation, and the PDA is working again in close association with the ADA to make sure this is taken care of and brought to a complete close with everything being accurate. A quick discussion about the credit union. The credit union came into effect. It's the ADA Credit Union, or the ADA-CU. It was officially launched back in October of 2025. It started with a soft launch in early October, and at this point, by the end of November, and I don't have new statistics, I hope to have them within the next time we meet, there was over 125 members invested with $2.57 million on deposit. As a result, we're going to pass on investigation, not for additional money to be available to dentists who are ADA members for financial assistance, but to go beyond that and look at dental students who, of course, due to certain federal guidelines, have less money available to them to now be able to potentially use the credit union to help make up for that shortfall. So stay tuned for more information on that. Lastly, let me tell you a little bit about the ADA ED search. So the executive director search has been comprehensive. It started back in Q1 of 2025 with a executive director search committee established. They then worked with a company called Russell Reynolds and Associates, which is a global leadership advisory firm with 50 years of experience, to help them do this appropriate executive director search committee. I will tell you that they had over 200 applicants. After multiple meetings, and they've been doing this again for months, they whittled that down to about 75. They brought that down to 25. They brought that down to 17. And then at this point, the goal is to bring that down to no more than 4 people that they will bring forward for the board of trustees to look at and hopefully make a decision. My understanding is there are 3 top candidates at this time. I don't know if a 4th will be sequestered or brought on or not, but certainly there are 3 terrific candidates, and I'm waiting for additional information. So at this point, that's where we are, and I just want everybody to know that this has been a true labor to go from over 200 applicants down to 3 or 4, and that's where we are at the current time. Hopefully by our next time we meet together, I'll have more information as to what's going on and where we are in terms of the ED search. With that in mind, thank you all. Have a pleasant evening.
Thank you very much, Dr. Talberg. It'll be interesting to see who will be our new executive director up there. All right, we now actually have Dr. Ted Rockwell doing double duty tonight as our representative on the Council on Dental Practice, as well as our PDA president. So, Dr. Rockwell, you got 2 reports.
Okay, I'll try to get through them, excuse me, pretty quick. Thank you, Ward, and thank you all the attendees for being here. It's a nice attendance, and I'm glad you're all here. The Council on Dental Practice. I have been recently appointed to the Council on Dental Practice, so I'm going to give you the most recent meetings that were online. There's basically the people I deal with on the Council of Dental Practice, and we have discussed at length whether or not to add 2 questions to both the ADA adult and the ADA children's dental health and medical health history forms. The question, do you use GLP-1 glucagon, like peptide-1 medication, was not really controversial and was adopted readily to be on the ADA's form under the medications and other products substances section. The second question is a question about mental health status. And there was a long debate about whether or not this question should be on the form. There was also a debate as to how to phrase the question. The debate centered around whether or not the mental health question would pose a risk of liability to dentists. Some believe that the general mental health question on a form was no different than asking a question about cardiac health or diabetic status. Others thought a mental health question is different depending on how it is worded. All agreed that the wording was important. So the final result was the question that was agreed upon was, over the past 2 weeks, have you felt connected to the world around you? Yes, no, or question mark for unsure. It was discussed that the primary purpose of a question, this question's mental health question, is to possibly refer the patient to another medical provider, such as a primary care physician, or for the dentist to possibly refer the patient to a mental health care provider as is appropriate to the particular circumstances at hand after talking with the patient. Another subject being looked at intensely by the CDP is reviewing emerging issues around augmented intelligence and artificial intelligence, as has already been discussed. The ADA policy toward AI is several years old, and because AI has changed so much and is changing so fast, CDP pointed out the need to update the ADA policy with a goal to be able to update the policy by the 2026 ADA House of Delegates. A long discussion at CDP was about oral health interoperability and about the Oral Health Interoperability Alliance, or OHIA, as an organization, and whether or not the American Dental Association should join the OHIA. It is not a member currently. As a definition, the Oral Health Interoperability Alliance is a multi-sector coalition dedicated to empowering patients, members, and authorized caregivers to securely access and share complete oral and medical health information, enabling coordination, trusted care from all dental and medical providers. The Alliance states it will transform oral and medical health care by enabling secure, easy sharing of both clinical and claims information across electronic health systems, leveraging open standards and a commitment to implementation. It was decided by the CDP that the ADA should be a part of this so that it can have some influence in development of these standards. Many members pay a fee annually to be a member as a way of providing funding for OHIA. Different members pay different amounts annually. CDP decided that it will recommend that the ADA become a member of OHIA as long as the ADA does not need to pay an annual fee. The reasoning is that the ADA can provide a lot of information that OHIA needs and that other groups such as dental services consulting, dental suppliers, and dental insurers cannot, and therefore the ADA contributes in this way. OHIA will be contacted and this discussion will be ongoing. Okay, so go to the next slide, please. And we'll start my president's report with the membership task force. Next slide, these are the members of the membership task force. It's quite big and quite varied. On December 9th, we had our first meeting. Dr. Marco Vujicic, PhD, Chief Economist and VP of the Health Policy Institute, presented his talk. He said he can help with slices of market share data, such as age, sex, and types of practice. He also said that the PDA might want to bring together small groups of non-members to collect qualitative and quantitative data from them on an informal focus group. On January 20th, the second membership task force meeting was held, and Dr. Paul Reese and Dr. Jay Friedman were nominated and elected as co-chairs. Mary Donlan provided the PDA membership task force with data for the last 20 years, broken down in 5-year increments. The total market share in 2005 was 62.6%, and in 2024 was 46.8%, with a steady decline from 05 to 24. In 2005, the total number of active member dentists was 4,492, and in 2024, it was 3,240, again with a steady decline. Noting the decline in membership, Dr. Friedman and Dr. Talberg stated they think it is a lack of perceived value. Dr. Talberg introduced the idea of a PDA forum where dentists can go to solve their problems and that is interactive, possibly utilizing Facebook or YouTube. Dr. Allison King noted Facebook and YouTube are still the most popular. Mary Donlan stated a very big challenge is increasing number of dentists working in DSOs, and many of those dentists feel the DSOs provide similar benefits to the PDA. Mary stated that the PDA needs to find a way to differentiate our member benefits. The next meeting for the membership task force will be sometime in February with a review of the proposal from Dr. Marco Vujicic to decide if we wish to purchase the data that he is getting from HPI because it is quite expensive. The Board of Trustees, next slide. The Board of Trustees met January 30th at Seven Springs Mountain Resort. Dr. Beth Troy asked why there is a non-member on the membership task force, and I explained that the idea is to have non-members on the task force to hopefully learn what would make the dentists want to become members. The current non-member is Dr. Katie Ryan, and she's an instructor at Pitt. Pennsylvania Enterprise Resource Corporation, otherwise known as PERC, made a motion at their December 12th meeting that go to a temporary staffing agency, be accepted as an endorsed vendor at a flat rate of $7,000 per year. It was unanimously approved at the PERC board meeting. This was presented at the BOT meeting, and it was also unanimously approved at the BOT meeting. GoTo is the new endorsed vendor for temporary staffing. The PDA is a member of the Public Affairs Council, and the Board of Trustees voted unanimously to have the Public Affairs Council to do a 45-minute presentation with questions and answers session for best practices for fundraising for PACs such as PADPAC in person at the BOT with possible virtual attendance too. There is no cost other than the possible travel and meals expenses for the presenter or presenters. PadPack, unlike AdPack, is lagging behind in its fundraising. So we need to learn how to do better fundraising. And that's the purpose for that. The board approved the new bylaws changes to enable the PDA to go ahead with the new council, committee, and working group structure previously approved by the board after work completed by the governance Sigma team of the Strategic Forecasting Committee. Dr. Stephen Raddick will be retiring as the Pennsylvania Dental Journal editor after 9.5 years. The board approved Dr. Karen Bryan as editor of the Pennsylvania Dental Journal, effective at the conclusion of the PDM on April 18th, 2026. The board also approved adding up to $1,670 to the 2026 budget to fund travel for Karen Bryan to the 2026 AADEJ Dental Editors University Conference in Chicago. The Board of Trustees approved Dr. Stephen Licht, an oral surgeon and a recent graduate of the University of Pittsburgh, to the new dentist committee. The BOT approved housekeeping amendments to the PDA campaign guidelines and PDA election procedure to bring the guidelines up to date with the new terms of our tripartite structure, including removing the term district and adding terms such as local society and treasurer-elect. Further, the BOT approved directed action to the election advisory group to review the campaign guidelines and make any recommendations to the BOT. A request was made by several members to form a task force with the goal of working with the legislature and/or Board of Dentistry to develop a category of licensure in Pennsylvania that will possibly have a reduced renewal fee and/or reduced biennial requirements for CE for retired dentists or possibly dentists who are semi-retired and only practice a certain number of hours a week. The task force would compare our regulations with other states. The BOT decided to refer this to the Government Relations Committee, and Dr. Darlene Oleski will lead the initiative, and a report will be made to the Board of Trustees at the July meeting. Dean Marnie Oakley. Let's move forward a little bit. Okay. All right. Dean Marnie Oakley requested that the PDA Board of Trustees work on promoting rural areas to practice in, since there is such a shortage and such an opportunity, as we've already discussed at this meeting. I propose that the PDA highlight practices including private rural hospital and FQHC practices each quarter. The BOT referred this to the Workforce Task Force with a report requested for the October BOT meeting. The Board of Trustees discussed, will the PDA develop a go-to interactive forum that dentists can go to solve their dental practice needs? The goal would be for the PDA forum to be the recognized and trusted source. The discussion noted that there are many dental online forums out there that are successful, and by studying these, it may help develop PDA's forum. And it was discussed that Facebook and YouTube may be good media to use. This was referred to the Strategic Forecasting Committee of the Pennsylvania Dental Association for further evaluation and development. This would be a member benefit if we had a very good go-to forum, and it's something that a lot of members on the task force are really interested in. The BOT, in conjunction with the CTR, Council of Trustee Regions, discussed all the candidates for at-large ADA delegates and alternate delegates. All candidates submitted CVs and an information sheet. Electronic voting for nominees took place January 30th, Friday afternoon until 6 p.m. The elected delegates was three delegates elected and 9 alternate at-large delegates elected. Next slide, please. These are the 12 members elected as representatives, delegates, and alternates at large. Okay, next slide, please. The leadership conference took place at 7 Springs Friday evening, right after the Board of Trustees meeting, January 30th and Saturday, January 31st. Attendance was very good. The topics were very good. The lectures were very good. The keynote speaker on Friday evening was Dr. Marnie Oakley, Dean of the University of Pittsburgh School of Dentistry, of Dental Medicine, and she was the keynote speaker. Saturday, January 31st, we had Jackson Kirchis, Dr. Savendra Bajan, and Dr. Herbray. They all presented, and all presentations were very interesting and enlightening. And those are the presentations right there. So it turned out to be a good board meeting, accomplished a lot of business, and had terrific CE and a leadership conference. Thank you very much. Back to you, Ward.
Thank you very much, Dr. Rockwell. A lot to cover between your two reports. And now, bat and cleanup tonight, the chair of our annual meeting steering committee, Dr. Ron Heier, with an update on the upcoming Pennsylvania Dental meeting. Dr. Heier.
Thank you, Ward. Thank you. The theme of this year's Pennsylvania Dental meeting, which goes by PDM, is Learn, Grow, and Lead. Your steering committee held 7 online meetings in order to plan an exceptional program this year. The PDM provides an opportunity for the dental community, all of us, to come together in one location for continuing education, discussions, and camaraderie while enjoying the beautiful 4-star AAA 4-diamond Omni Bedford Springs Resort and Spa. And it is really a beautiful place with beautiful meeting rooms and amenities. The rooms are great value too, $249 plus 8% tax per night, which is considerably lower than the $456 price I found the other day on the Omni Hotel website. PDM 2026 offers 12.5 CE dental credits. We provide required courses such as Act 31, which is child abuse with Dr. Angel Stout, and Act 124 opioids with Dr. Catherine Feckin speaking on evidence-based analgesia for post-surgical dental pain. We have emergency preparedness in the dental office, Dr. Ross Carlin presenting, and Dr. Mark Hyman, who many of you know from his wonderful team building courses, is going to be giving a course on restoring dental implants, which is a lot of cases from the UNC School of Dental Medicine. And Dr. Robert Morris, who I've heard a couple times, is just a fantastic practitioner. He's going to be speaking on restoring teeth with high strength injectable composites. Go to the next slide, please. On Saturday afternoon also, there is a resident and student research poster presentation with judging by the Pennsylvania Dental School deans or their representatives. Last year, we had 8 students participate, and it was a wonderful opportunity for our members to judge the different poster contests and get 1 hour of CE for doing that. We also have discussions with the ADA president, Dr. Richard Rosado is going to be there, and Marco Wojcik is going to be speaking, as you've heard him before, on the ADA health policy. He's the Institute chief economist and vice president for the ADA. And I'm sure we'll hear more about the workforce issues that Ward and Dr. Himmelberger talked about earlier. Our keynote speaker is going to be Major General Sean Collins, and he's going to be examining leadership in life and service. The PDM, clear the next slide, please. The PDM is also going to have ample opportunities for camaraderie with network receptions all 3 days. Thursday evenings is the informal meet and greet your leaders reception sponsored by Dr. Ted Rockwell, Jim Mancini, and Jim Tauber. Weather permitting, there'll be drinks and s'mores around the fire pits outside. Friday evening is the welcome reception, followed by the member celebration and award dinner. It's always a nice, more formal affair with a great food. The meeting concludes with a joint reception on Saturday afternoon, sponsored by the American College of Dentists, International College of Dentists, and the Pierre Fauchard Academy. The Omni Bedford Springs offers numerous activities, including an 18-hole golf course, the Springs Eternal Spa, fitness center and classes, indoor heated pool, on-site hiking, and off-road vehicle tours. And also, the Flight 93 National Memorial is just 40 minutes away. This has a wonderful visitor center, Memorial Plaza, and Tower of Voices, which is a 93-foot tall tower with wind chimes. So for more information about the meeting, visit the PDA website at padental.org/PDM for more details, or call the PDA and ask for extension 117 if you have any questions. Please be sure to share information about the meeting with your colleagues at any chances you get. I'd like to thank Rebecca Von Nita and the members of the steering committee for organizing an exceptional dental meeting, and hope you all take the time to attend. I look forward to seeing everyone April 17th and 18th at the Omni Bedford Springs and Resort and Spa. Back to you, Ward.
Thank you very much, Dr. Heier. And I agree. We've had a board meeting out there at the Omni, and it's a gorgeous facility. Hope a lot of you will take advantage of it. It is now time for our question and answer segment. Have not had a lot of questions typed in so far, but you do have time if you want to sneak one or two in before we adjourn at the bottom of the hour. I did have a question from Dr. Christian about Lobby Day, which I've given an answer, but I'll go ahead and do live since Dr. Yap's no longer with us. She had another meeting she had to drop off for. In short, anyone can attend Lobby Day. The real question is whether or not you will get reimbursed for your travel. Only certain number of people will get reimbursed by the ADA. They give us one spot for each member of Congress, one spot for each senator, and actually one extra spot for a new dentist technically, but that's it. And they're supposed to be filled by what they call action team leaders, who are the primary points of contact for those members of Congress, senators, etc. We can substitute somebody for an action team leader if one of our designated action team leaders can't make it, so we could have a full complement. You want to have ideally a constituent for each of those members of Congress be in attendance for when we go to do the Hill meetings. But that's it for the number of people who can be actually reimbursed, and there's a lot of hoops to go through in terms of how you book, which is why it's not widely being distributed how you register. If you want to attend and pay your own nickel, that's fine. To get the link to register, you just have to contact the PDA Governmental Relations Department. So hopefully that answers the questions about Lobby Day. It's a totally different format in some respects, but that's actually pretty close to what they've done in the past, just a little tighter on who they will reimburse. And I think that's directly attributable to the tighter budget at the ADA these days. So any other questions have come in? I am not seeing any at this time. At that case, we have just a minute here. Any panelists have a question that they would like to ask and get answered live for the benefit of our audience? All righty then. Well, nothing wrong with ending a few seconds early. I'd like to thank everybody for joining us tonight, and just remind you that we do record these. So if you have some colleagues who would have enjoyed getting to see this, but they had something else going on tonight, they just need to go to the webinar and video library on the PDA website. Once you've logged in, it's fully accessible for members, and all of our video content is there, anything from the Front Street 411s to educational webinars, and of course, all these Bridging the Info Gap leadership webinars. And we do this every other month. So we hope we will see everyone here the next time, which will be April 7th. Same time, we do them alternating Mondays and Tuesdays every other month. So it's pretty easy to plan ahead, and we'd love to see even more join us. It won't be as quite a festive occasion. I won't have a reason to wear my groundhog tie in honor of the day it is today, but it will be as informative. I'd like to thank tonight's panel. Perfect job, a lot of information, and we appreciate you taking the time out to give all that information out to our members. With that, bid everyone a great, wonderful rest of your week, and hope you enjoyed the thermometer finally getting above 32 again. Good evening, everyone.